I wanted to start with a little bit about the Burlington OHD. So we have an attributed population that's just under 250,000. We're mostly urban, suburban. In terms of geography, 25% of our attributed population are actually 65 plus. So it makes sense to have vulnerable seniors as a priority population since the inception. In terms of our internal capacity for evaluation, we are a very small but mighty team of two, including myself and a part-time data analyst. However, we are supported by a huge culture of understanding, commitment to evidence-based decision-making, measurement, and continuous improvement. The approach that we're taking since even before I joined the team is that we use a learning health system approach to planning our services, monitoring and evaluation, learning, and then assessing the impact and whether we scale or redesign any intervention that we have been implementing. Today, I'm going to be walking you through one example, so one program from start to end in terms of evaluation journey, just to be a little bit giving an example based on all the amazing things that we've heard from Catherine now, how to put this into action, kind of, is called the Community Wellness Hub. The Community Wellness Hub is an alliance of health, housing, and social service providers that coordinate and deliver services to seniors at the place of their residence. So think about a NORC building, so a naturally occurring retirement community. Most of the individuals living there are living with lower than optimal social terms of health. Of course, they're high users of the healthcare system. So how can we create a team out of all the providers that are already visiting this building to create an integrated care system within this building? For that, the main values of the program would be proactive, holistic, and integrated care, of course, interdisciplinary teams who are working as one team, serving equity-deserving populations, which are seniors living with lower than optimal social terms of health, and of course, being cost-effective and being able to scale it. All sounds nice, right? Okay, we'll keep going. In order to achieve this vision, the main components of this program is an on-site community connector. So you can think about this person as the glue that puts everything together. We have the interdisciplinary service providers who act as a team currently. Most of the time, it's anywhere between 10 and 20 providers within any of the buildings. And we are trying to kind of enforce this vision of it's a team. And I'm going to revisit this while I'm talking in in couple minutes. We started with one hub in one building. This was in 2020. Now we are having 8 buildings that are covered. 4 in Burlington, 2 in Oakville, and 2 in Greater Hamilton Health Network, supported by the Greater Hamilton Health Network OHT. And we are expanding to 2 more in 2025. As I described the hub, and as Walter said earlier, that any intervention within an integrated care network can be viewed as a complex intervention. The only problem is that once you start thinking about the evaluation, the big question that always pops up is the work. However, most of the complex interventions, you can't answer this question that easily, and it can be the first question, the first evaluation question that you're asking. What does it take to implement evaluation findings within an integrated system or within a system of providers that are not working together, like in one organization, for example, like when we don't have a mandate for evaluation? These are what I've learned while working within the BOHT. First of all, engagement from start to finish, especially leadership engagement, was key to the success, if there was any success in the evaluation process. Also, be open to innovation. Be open to say, like, let's try something new. The whole idea of this one care record, a digital record that all the providers who belong to so many organizations can access and use, was an innovation. But we were able to prove that it's working, and we're able to find some funding for it. Also, seek funding opportunities whenever they are. Be open to fail, but fail forward. Create sense of urgency while you are planning for the evaluation, implementing the evaluation, or sharing the results and enacting the results of the evaluation. Sense of urgency is always important. Also, sense of ownership is important. Change management all through. And it's always a collaborative approach. The hub is pretty popular. Over the last 3 years, we presented 50 times about the hub, internationally and nationally and locally. We've also have been featured in the Toronto Star in summer, and also the Ontario Hospital Association wrote an article about Hub and its impact. Thank you.